I just really loved watching medical shows and learning about the human body, and I knew when I was around 11 years old that it was going to be the career for me. My name is Cassie Majestic. I am an emergency medicine physician in Orange County, California. My first day at work, gosh, I just remember it being a total whirlwind. I was trying to see patients and apply the skills that I had learned in medical school. It was so stressful, and I really think my entire first year of residency was kind of a blur. I don't think I retained a lot of information, and I was just trying to get by and, learn how to keep patients alive at that time. It's just kind of an unbelievable feeling, really connecting with patients in their scariest moments and connecting with their families. And so it's motivating to know that going through all of this training, I have the knowledge to help them in a time when it's very, dire. A lot of the time you're running from one thing to the next, and you try and be strong for patients and their family members. But I think it's a lot harder when you get home and you kind of reflect on what you've experienced at work. I think the most challenging part of my job is the amount of time that I spend at work and the amount of time that I switch my sleep schedule. I'm also very invested in my patients, and so a lot of my time is spent calling them back, completing their charts while I'm at home. And it's easy to kind of forget about your personal life and maintaining a good balance. So that has taken some work to master. I have not yet mastered it, but I'm getting better. So I started doing social media when I realized that I wanted more out of my career than I could get just by being at work. So I have a very short amount of time to educate patients. It's 5 to 15 minutes total when it's very busy. And I felt like I wasn't really having that connection, emotionally with my career because of that rushed nature. So social media has allowed me to educate whoever out there wants to listen about various medical topics, lifestyle balance, health, wellness. And what I really gained from it was a huge following from pre-med students, medical students, and that's something I wasn't really expecting. So that actually has allowed me to give back a lot of my experiences, in a very detailed manner so that they understand and they know kind of what a day in the life of a physician is like.